will provide an update on the COVID-19 vaccine rollout in Canada. Bonjour, bienvenue au briefage technique afin de donner une mise à jour sur la distribution des vaccins contre la COVID-19 au Canada. Today, we will hear remarks from Dr. Howard New and Major General Fortin from the Public Health Agency of Canada. They will be accompanied by Joël Paquette from Public Services and Procurement Canada to answer questions. Aujourd'hui, nous entendrons des allocutions du Dr. Howard New et du Major Général Danny Fortin de l'Agence de santé publique du Canada. Ils seront accompagnés par Joël Paquette de Services publics et Approvisionnement Canada pour la période des questions. Following the remarks, we will open the teleconference line for questions from the media. Suite à la présentation, nous répondrons à vos questions. If you wish to ask a question, please press star 1 on your phone. Si vous désirez poser une question, veuillez appuyer sur étoile 1 sur votre téléphone. Procédons à la séance d'information technique. Let's begin today's technical briefing. Over to you, Dr. New.
Thank you very much. Merci, Anne. And hello, everyone. And thank you for joining us at today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Danny Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. We will each provide brief remarks and then open the floor to questions. To assist us in answering your questions, we have with us Joël Paquette from Public Services and Procurement Canada. To date, more than 8.8 million doses of COVID-19 vaccines have been administered in Canada. Among those 80 years of age or over, 84% have received their first dose and 12% have received their second. And among those 70 to 79 years of age, 69% have received their first dose and 3% have received their second. As vaccination programs continue to roll out across the country, more and more scientific information about COVID-19 vaccines is becoming available. Health Canada, the Public Health Agency of Canada, and the many partners we are working with to end this pandemic continue to pay close attention to the unfolding situation. We monitor, we assess, and when necessary, we will respond promptly and effectively, each according to our respective mandates. Health Canada and the Public Health Agency of Canada's robust and continuous post-market vaccine safety surveillance system captures reported adverse events following vaccination with authorized vaccines. When a new potential safety concern or adverse event following vaccination is brought to our attention, a thorough examination and assessment occurs to determine if the event is related to the vaccination. If necessary, prompt, appropriate action is taken. Every week, the Public Health Agency of Canada publishes information on adverse events following COVID-19 vaccination. As of April 9th, there have been 3,444 reports of adverse events following vaccination to date. These include any mild medical event that occurs following vaccination, such as soreness at the site of injection or a slight fever, but isn't necessarily related to the vaccine. 464 of these reports, about 1 in 16,000 doses administered, were considered serious, such as a severe allergic reaction. All serious events undergo a detailed investigation. As you know, earlier this week, Quebec health officials announced the first reported case in Canada of a person who experienced an adverse event involving blood clots with low platelets after receiving the AstraZeneca vaccine, following the administration of more than 709,000 doses of this vaccine across the country. The report of this case, Canadians can be confident in our vaccine safety monitoring system and indicates that this is a very rare adverse event. I took the opportunity last week to explain to you the role of the National Advisory Committee on Immunization, or NACI, highlighting important differences between its perspective and how it works compared to the regulatory responsibilities of Health Canada. One of the reasons I did this was to help Canadians understand that the advice and operationalization of plans related to vaccination will evolve and why this is so. NACI will continue to update its recommendations on who should receive which vaccines and how. We can also expect some of these updates to differ from the information that Health Canada has authorized, as NACI applies a public health perspective in providing their recommendations that also considers the changing epidemiology and available vaccine options in Canada. Taken together, the guidance and decisions of NACI and Health Canada enable the provinces and territories to achieve the best outcomes for the greatest number of Canadians as quickly as possible in this pandemic context. For the millions of Canadians who hear and see extensive coverage every day about the pandemic and where we are in the race between COVID-19 vaccinations and COVID-19 variants, this is a challenging time. In addition to a dose of vaccine, people need a dose of confidence. Canadians can feel assured that the COVID-19 vaccine dose they have received or will soon receive is safe and highly effective. Finally, let us also keep in mind the necessary public health measures that are proven to help prevent the spread of COVID-19. I urge everyone to get their vaccine when their turn comes up. I received my first dose of vaccine last weekend as a consultant physician at the Ottawa Hospital. However, I also urge everyone, even after you get the vaccine, to continue to adhere to public health measures such as social distancing, wearing a mask, and washing your hands frequently. Thank you for your continued efforts to keep our communities and loved ones safe. Bonjour à tous et à toutes et merci de vous.
Good morning, everyone. Thank you for joining us for today's technical briefing on Canada's COVID-19 vaccine rollout. I'm here with Major General Danny Fortin, Vice President of Operations and Logistics at the Public Health Agency of Canada. We will each provide brief remarks and then open the floor to questions. To assist us in answering your questions, we have with us Joël Paquette from Public Services and Procurement Canada. To date, more than 8.8 million doses of COVID-19 vaccines have been administered in Canada. Among those 80 years of age or over, 84% have received their first dose and 12% have received their second. And among those 70 to 79 years of age, 69% have received their first dose and 3% have received their second. As vaccination programs continue to roll out across the country, more and more scientific information about COVID-19 vaccines is becoming available. Health Canada, the Public Health Agency of Canada, and the many partners we are working with to end this pandemic continue to pay close attention to the unfolding situation. We monitor, we assess, and when necessary, we respond promptly and effectively, each according to our respective mandates. Health Canada and the Public Health Agency of Canada's robust and continuous post-market vaccine safety surveillance system captures reported adverse events following vaccination with authorized vaccines. When a new potential safety concern or adverse event following vaccination is brought to our attention, a thorough examination and assessment occurs to determine if the event is related to the vaccination. If necessary, prompt appropriate action is taken. Every week, Public Health Agency of Canada publishes information on adverse events following COVID-19 vaccination. As of April 9th, there have been 3,444 reports of adverse events following vaccination to date. These include any mild medical event that occurs following vaccination, such as soreness at the site of injection or a slight fever, but isn't necessarily related to the vaccine. 464 of these reports, about 1 in 16,000 doses administered, were considered serious, such as a severe allergic reaction. All serious events undergo a detailed investigation. As you know, earlier this week, Quebec health officials announced the first reported case in Canada of a person who experienced an adverse event involving blood clots with low platelets after receiving the AstraZeneca vaccine, following the administration of more than 709,000 doses of this vaccine. The report of this case shows that Canadians can be confident in our vaccine safety monitoring system and indicates that this is a very rare adverse event. I took the opportunity last week to explain to you the role of the National Advisory Committee on Immunization, or NACI, highlighting important differences between its perspective and how it works, compared to the regulatory responsibilities of Health Canada. One of the reasons I did this was to help Canadians understand that the advice and the operationalization of plans related to vaccination will evolve, and why that is so. NACI will continue to update its recommendations on who should receive which vaccines and how. We can also expect some of these updates to differ from information that Health Canada has authorized. As NACI applies a public health perspective in providing their recommendations that also considers the changing epidemiology and available vaccine options in Canada. Taken together, the guidance and decisions of NACI and Health Canada enable the provinces and territories to achieve the best outcomes for the greatest number of Canadians as quickly as possible in this pandemic context. For the millions of Canadians who hear and see extensive coverage every day about the pandemic and where we are in the race between COVID-19 vaccinations and COVID-19 variants, this is a challenging time. In addition to a dose of vaccine, people need a dose of confidence. Canadians can feel assured that the COVID-19 vaccine dose they have received or will soon receive is safe and highly effective. Finally, let us keep in mind the necessary public health measures that are proven to help prevent the spread of COVID-19. I urge everyone to get their vaccine when their turn comes up. I received my first dose of vaccine last weekend as a consultant physician at the Ottawa Hospital. However, I also urge everyone, even after you get your vaccine, to continue to adhere to public health measures such as social distancing, wearing a mask, and washing your hands frequently. Thank you for your continued efforts to keep our communities and loved ones safe. I will now invite Major General Danny Fortin to deliver his remarks.
Merci beaucoup, Dr.
Thank you very much, Dr. New.
So to date, we have distributed 12.7 million doses of all types of vaccines to provinces and territories. Earlier this week, we received 1 million doses of Pfizer-BioNTech, and deliveries to provinces are now complete. A steady flow of 1 million doses still expected to be delivered on a weekly basis all the way through to end of May. And for June, Pfizer-BioNTech has confirmed upcoming deliveries of nearly 2 million weekly for a total expected of over 17 million doses of Pfizer-BioNTech this quarter. Earlier this week, 855,000 doses of Moderna arrived in Canada. Distribution to provinces and territories are underway and expected to be completed today. The following shipment is expected to be around 1.2 million doses, with the delivery at the end of April. Also, Moderna has confirmed that in May, Canada will receive 2.8 million doses in 2 shipments, one in mid-May and the other at the end of May. We will be issuing allocation tables to provinces and territories today to inform them the quantities they can expect to receive for each of the 2 shipments. Last Thursday, 317,000 doses of AstraZeneca were picked up from Europe, and deliveries to provinces started Friday, April 9th. We anticipate completing all deliveries by the end of this week. As vaccination programs continue to roll out, our distribution tempo will keep on increasing. We held a round of high-level discussions with provinces and territories this week, focused on vaccine distribution and immunization in each jurisdiction. We shared observations, compared notes, and identified best practices are worth sharing. I'd like to emphasize that throughout the country, numerous teams of dedicated Canadian professionals are working relentlessly on a timely and effective distribution of vaccines in the deliberate immunization effort, and will continue to work very closely with all stakeholders. Alors, bon matin à tous et à
Good morning, everyone. To date, we have distributed over 12.5 million doses of vaccines to provinces and territories. Earlier this week, we received 1 million doses of Pfizer-BioNTech, as expected. Deliveries to provinces are now complete. A steady flow of 1 million doses is still expected to be delivered on a weekly basis until the end of May 2021. And for June, Pfizer-BioNTech has confirmed upcoming deliveries of nearly 2 million doses weekly, for a total expected of over 17 million doses of Pfizer-BioNTech this quarter. Earlier this week, 855,000 doses of Moderna arrived in Canada. Distribution to provinces and territories are underway and expected to be completed today. The following shipment is expected to be around 1.2 million doses, with the delivery at the end of April. Also, Moderna has confirmed that in May, Canada will receive 2.8 million doses over 2 shipments, one in mid-May and the other at the end of May. And today we will be sending allocation tables and delivery schedules to the provinces and territories. Last Thursday, around 317,000 doses of AstraZeneca were picked up from Europe, and deliveries to provinces started Friday, April 9th. We anticipate completing all deliveries by the end of this week. As vaccination programs continue to roll out, our distribution tempo will keep on increasing. We held a round of high-level discussions with the provinces and territories this week, focused on vaccine distribution and immunization in each jurisdiction. We shared observations, compared notes, and identified best practices worth sharing. In closing, I would like to emphasize that throughout the country, numerous teams of dedicated Canadian professionals are working relentlessly on the timely and effective distribution of the vaccines and the deliberate immunization effort. Thank you. And now we are ready for your questions.
We will now open the phone lines to questions. We ask that you limit yourself to one question and only one follow-up. We will be taking questions in both official languages. Nous vous demandons de vous limiter à une question et seulement une question suivie. Vous pouvez poser vos questions dans l'une ou l'autre des langues officielles. We will start with the first question. Première question, opérateur.
Thank you, merci. Please press star one at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. And the first question is from Rachel Haynes from CTV News. Please go ahead.
Hi there. My first question would be for Major General Danny Fortin about the Moderna delays. We've now had multiple Moderna delays since we started receiving these vaccines. So do you trust that they're actually going to come when they say they are coming going forward?
Thank you for your question. To start off, I would say that Moderna has increased its production capacity over several weeks. You will recall several weeks ago, Moderna delivered on a 3-week cycle, and they've moved to a 2-week cycle. They have experienced and continue to experience a quality assurance processes backlog. It's not a production problem. It's part of the entire process of getting vaccines out the door to countries. And we've worked on narrowing down the window at which we can pick up those vaccines. So the vaccines that were distributed this week were initially scheduled for last week. And it might have been challenging for provinces as they had to rejig their schedule. And now those vaccines are out for distribution. And the next wave of vaccine was initially scheduled for next week. What I'm saying is that we're going to work on the assumption, a very reasonable assumption, that we can pick up at the front end of the last week of this month, with distribution complete at the end of this month. That's our objective, and we're working closely with provinces and territories to risk manage this efficiently. I think it's worth mentioning that we're fully aware that provinces are making adjustments, and we're trying to narrow this down as much as possible so that they don't find themselves in a situation where they have to constantly react to perceived delays. So we're issuing as clear as possible a window for provinces and territories to plan their immunization campaign with.
Merci beaucoup. Follow up, Rachel.
Yes, thank you. I just would like to follow up on what you're saying there about some of these windows for these provinces, because even now, a lot of cities and provinces, especially here in Ontario, are saying that their supply is dramatically being affected by these Moderna delays. And there are some concerns that they may have to start canceling appointments, or that they may not have enough supply to book going forward. So I'm just wondering, how do you reassure these provinces and cities that they are going to be able to vaccinate people going forward, even with these delays?
Well, a key element of our discussions this week was to really reassure provinces and territories that we are aware of the issue, that we're working closely with the manufacturer to narrow down this window. And I'm not going to speak for Moderna. I'm not going to speak about a particular province, but I can tell you that provinces are they're all intent on distributing or vaccinating as rapidly and as effectively as possible. And now, when delays in shipments occur and further distribution down to the remote or rural clinics take place, there may be some delays here that negatively affect the campaign for sure. There are provinces that only open up appointments upon confirmation of vaccines arriving in country. That is one way. Another way is to risk manage very tightly and work with the assumption that doses will arrive on a specific date, and then when that slips by a day or two or three or more, that forces cancellation. There's no good way of doing this. I think we need to carefully manage this so that we avoid putting ourselves in that situation in provinces, and provinces manage that plan as effectively as they can. Several provinces have experienced the delays or have had to reschedule appointments, and we're working with them closely on managing that so that the effect is not felt as much moving forward. So narrowing down those windows with a certain degree of certainty about the pickup dates and delivery dates to provinces and territories is really very much our effort. And as we get closer to those dates, we'll further narrow this down and confirm that with provinces early enough. The hope is early enough so that they can readjust their plan without negative impacts.
Thank you. Next question, opérateur.
Thank you, merci. La prochaine question est de Alexis.
The next question is from Alexandre Riopel Le Devoir. You have the floor. Good morning. Thank you for the technical briefing. I was wondering if you have more details on the AstraZeneca vaccine doses coming, given that you only talked about the doses that have already arrived. So what can we expect in the 2 coming months for that vaccine? General Fortin, I think I'll give the floor to Ms. Paquette, but currently we have 2.3 million doses of AstraZeneca in the country, whether from the Serum Institute from India or from COVAX or from the American manufacturer. And we're managing this with the provinces and territories. And when other doses arrive, they will be added to the doses available for those who are concerned. Thank you for the question. The upcoming timetable for delivery to Canada, we're in discussion with AstraZeneca about that. Regarding our agreement with them, we're looking at 1 million doses in June. For the doses coming from India, there will be a delay given the situation currently and the exports that aren't advancing from India. And now we're looking at June. And we're also in discussion with AstraZeneca for getting them earlier. Thank you.
Question suivie, Alexis.
Follow-up, Alexis? Yes, I was wondering if the challenges in some clinics with administering AstraZeneca doses, with people being a little bit more reluctant, if that would change your plans or the plans to obtain more doses more quickly from AstraZeneca.
Au point de vue de l'approvisionnement,
regarding procurement, our goal is to get as many doses as possible as quickly as possible. So that's always, well, anyway, what we're trying to do is get as many doses as quickly as possible. And that's the discussion we're having with companies, including AstraZeneca.
Merci. Prochaine question, opérateur.
Merci. The next question is from Marika Walsh, the Globe and Mail. Please go ahead.
Good morning. Thank you so much for taking our questions. Major General Fortin, can you please clarify the next shipment from Moderna? Ontario is saying this morning that it's actually a 2-week delay, and they've now been told that they will get the vaccine the week of May 3rd. You just said by the end of April. Can you please clarify which it is?
Yes. So we've worked with Moderna, and we've informed provinces of the intent here. We have reasonable assurances that we can pick up vaccines in Europe early to mid-week, last week of April, and distribution will take place as rapidly as possible following that. In our experience so far is that the vast majority can be distributed within 2 or 3 days after receiving, and with that kind of quantity. And that is distributed to different locations and provinces. Some provinces, it is distributed to a number of sites by federally. Others receive it at a central depot and further distribute, and that's the responsibility down to the last mile. This responsibility of the jurisdiction, the province or the territory. So there's a mix, there's a blend here of options for the delivery that might result in longer delays down to the rural or the remote location. So we're not working on hope. We're working with a high degree of probability that those doses will be picked up in that time frame that I just laid out, with distribution taking place by the end of that week, last week of April. It is possible that it goes into the beginning of the following week. At this time, I cannot say for certain it will be complete by Friday. It will take place, early in the next week. But we have a higher degree of probability, a certainty that this can take place in the last week of April. And those different options were discussed, and that might be why this comment was made by one or more provinces. And we'll continue to work on narrowing this down as much as possible for effective vaccination campaigns throughout the country.
Okay, thank you so much. And going back to the question that was asked in French earlier on AstraZeneca, can Ms. Reza or Major General Fortin please explain why it is that our first delivery is maybe in June or is in June from the main AstraZeneca contract? What is going on with that it is so sporadic in terms of getting it in? And what impact does that have on the vaccination rollout?
I'll turn this over to Mrs. Paquette, but I would, as I indicated earlier, we have 2.3 million doses in country right now from the different AstraZeneca streams, and that's being administered throughout the country, and provinces and territories will when we receive more, we'll distribute that across the country and manage that as effectively as possible.
Yeah, thank you for the question. We're actually working with AstraZeneca on their delivery schedule, and we are informing that it's 1 million doses starting in June. The exact date of that distribution is unknown at this time, but we continue to work with the company to solidify that calendar. Thank you.
Opérateur, next question.
Thank you, merci. La prochaine question, Annie Gay.
The next question, Kajiko News. You have the floor. Thank you. Good morning, everyone. Major Fortin, you spoke about best practices for distributing vaccines. In Quebec, we're reaching those who are over 60 throughout the country, throughout the province. And then we have walk-ins for those over 55 with AstraZeneca. But the popularity of that vaccine varies quite a bit, whereas Pfizer and Moderna are selling like hotcakes. Do you suggest we accelerate the distribution, that we change age groups more quickly? Is that part of the best practices you're seeing elsewhere? Because now we seem to have too much AstraZeneca and not enough Moderna and Pfizer.
Oui, c'est un très
Yes, that's a great point. I only have a part of the answer because suggesting a different age group isn't under my responsibility, not at all. But there are very good practices that have been identified. In Quebec, you mentioned the walk-ins. That's not something that's being done throughout the country. However, some provinces are using mobile clinics the vaccine take-up rate is lower with a mobile clinic when a doctor or nurse is going to give one vaccine at a time, so that's slower. There are different methods, whether there are super sites like at the Olympic Stadium. There's more than 100 super sites in Ontario. There's the RBC Centre in Winnipeg. That's another example. So there are different ways of proceeding. Some jurisdictions have an age group approach. Others have looked at vaccinating people who are working in certain specific environments. So there's a mix with the current circumstances in different jurisdictions, and it's worth examining that and for other provinces to learn from that. And so we'll be sharing those observations over the coming days in a short summary to provide that to provinces for their consideration. Thank you. To follow up with Dr. New, yesterday we spoke with Health Canada regarding the risks of AstraZeneca or the lack of risk based on age and sex. We know that there will be discussions on that today. Could you talk to us about this decision-making chain on who will receive that vaccine and when we'll have a review of the criteria of it being for those over 55? Thank you for the question. It's a pleasure to explain the process. It starts with Health Canada. On Wednesday, yesterday, they made their statement, their analysis of the evidence, and it remains unchanged. Based on their analysis, the AstraZeneca vaccine is effective, and it's certain that the benefits and advantages far outweigh the very, very low risk of rare adverse effects with blood clots. So NACI takes that into consideration, Health Canada's analysis, and NACI looks at other evidence, other information that's available, and they take another perspective, a broader perspective with public health. For Health Canada, it's only about analyzing one product at a time. They look at one product, one vaccine, what are the benefits and the risks? For NACI, it's also important to look at what the epidemiology is that can change throughout the country, in some regions of the country. So what are the other choices? What are the other vaccines available in Canada? So with all of that in mind, They're doing their analysis and currently holding discussions right now. And I think next week we're waiting impatiently for the results of their deliberation. And then it's always the provinces and territories with their chief public health officers who receive those recommendations from NACI in order to look at their own epidemiological context and other factors like vaccine supply and other factors in their own jurisdiction to make the decision to operationalize, to take advantage of vaccines for the benefit of their own population. So that's the process with the 3 steps: Health Canada, NACI, and then the provinces and territories.
Merci, Dr. New.
Thank you, Dr. New.
Opérateur, prochaine question.
Thank you, merci. The next question is from Ryan Tumulty, National Post. Please go ahead.
Yeah, hi there. Dr. New, I'm wondering, there's a lot of discussion about whether or not Canada could have, with earlier vaccines, avoided the third wave. I wonder if you think that's possible, and also what level of vaccination do you expect we will have to reach before we start to see a noticeable decline in cases?
Okay, thank you for the question. So I've understood the first part about the third wave and whether we could or should have avoided with just the vaccines, or maybe you could repeat that part. I'm not sure if I understood that correctly.
Yeah, I'm wondering if you think a higher pace of vaccinations into Canada could have prevented the third wave.
In my estimation, certainly there's lots of factors in play, but I would say that no, it's certainly not just an issue or a factor of the vaccines alone. I think along with lots of other experts and public health authorities across the country, have always indicated that the vaccines are one tool in our toolbox and a very important tool, but it's not the vaccines alone that are going to solve it all, and certainly take care of the third wave, in which unfortunately we're in many parts of the country. It's still a very sort of tight application of the proven public health measures, both at an individual level and also at a population level. And so I think you're seeing that being put in play right now in various provinces. They're looking at all sorts of restrictions, be they travel, be they obviously closing down certain businesses and so on. So that's going to be very important. Certainly, the wild card, I think, is the I would say the further spread of the variants, and I think that's something that obviously we said before is quite concerning. But what to me it shows is that we need to double down on our efforts with our public health measures as the vaccine rollout proceeds, because with the variants being in many cases much more transmissible, contagious, and also leading to more severe consequences, hospitalizations, and deaths. It just shows that people may have, to be honest, they may have gotten away. Let's say if you have that, encounter with someone and you actually are quite close to them for more than 15, 20 minutes, maybe with sort of the old sort of wild strain, or I guess the original strain of a COVID-19 virus. You might not have picked up the infection, but certainly with the variants, we've seen time and again that much more transmissible. And so I think shorter period of time of exposure and so on and so forth. I think it shows that the people really need to double down in terms of the use of face masks, the physical distancing, and so on. With the vaccination, I think certainly after the first quarter, many millions more of doses are coming into the country, and so I think we're in a good position. You can see in the different provinces, they're starting to really get to all of the priority groups. At the beginning, it was just our seniors and healthcare workers, but now they're also reaching to other groups that might not just be necessarily strictly age-based, but also looking at other essential workers and so on. So I think that's all good news. In terms of where we need to go in terms of vaccination. Again, I would say it's not just a matter of vaccination rates alone. I think, as I've said before, it's more a matter of following the data, not dates. We need to look at our vaccination rates, but we also need to look at the other indicators. For example, what is sort of the incidence rate of cases, hospitalization, deaths, and so on and so forth. So all that put together, I think will give us a better picture. At this point, things are looking pretty good for everyone in Canada being offered their first dose of vaccine. I think, sometime in the summer, about June-ish or so, sometime in June, and then certainly by the end of the summer, if all goes well and according to plan in terms of vaccine supply and so on, then all Canadians should have been offered, quote, their second dose by the end of the summer. So I think that's all good. And then once we have 2 doses in most people, and I think that's another point I think we should emphasize, is that even though there are lots of eligible Canadians who can be offered the vaccine, it's also a matter of taking up the vaccine, because we need a certain level of uptake by Canadians to make this all work, in addition to all of the other things we need to do. So we'll have to see, but I think at this point, we're just going to keep at it with Major General Fortin and the colleagues in the provinces and territories to just keep vaccinating as many Canadians as possible, as rapidly as possible, and then we'll see where we are later in the summer. Thank you.
Ryan, follow up?
Yeah, just as a follow-up, the schedule that you've outlined today, the 2 million doses coming in June, plus for Moderna to meet its targets, I assume it would have to be delivering quite a lot of doses in June as well. When the vaccines ramp up again in June, how comfortable are you with the ability of the provinces to handle that many doses in such a short period of time, I guess? And I'm also wondering if you have any update on J&J's deliveries.
Mr. General Fortin, I'll take the first half of the question here about capacity and throughput in provinces and territories. There's no doubt that provinces are fully aware of their need to scale up, and they have been scaling up for the last several weeks. And in our discussions, all are acutely aware of the growing number of Pfizer and Moderna into June onwards. So there are estimates of their capacity, the throughput capacity in provinces that vary, 50 to 70%, which adjustments and different modalities are being used. They could probably administer lots of vaccines fast in super sites, but we would not necessarily have an equitable approach across the landscape. So it's a mix of different modalities that is really key. And knowing full well that some smaller pharmacies, some smaller general practitioner offices and so on, the throughput would be reasonably small, but they will access a segment of population that would not have easy access otherwise. So that kind of paints a picture of how complicated it is to immunize from a non-professional. That's how I would term it, describe it. The other piece is the distribution all the way to those various sites that varies. And provinces are telling us that they are prepared to scale up, not without challenges. And the purpose of those discussions is to really find ways to really share ideas and best practices and have a good understanding of how deliberate those plans are. And really, there are lots of plans on the go and capability that is untapped, that is identified for when larger quantity of vaccines arrive. So I guess in short, provinces are aware, territories are aware, they anticipate the growth, they're lining up all the resources, and we're ensuring that we're in close contact here so that they can plan better. It goes back to my argument earlier. The more predictability we're providing, that's what provinces are all asking for. We want vaccines, we want predictability, more importantly. And we work hard on providing as much clarity as possible for them to scale up on a deliberate manner and not create unnecessary friction and problems along the way.
And on the Johnson & Johnson vaccine, we're still tracking for the end of April, but we do not have additional information at this point to provide. Thank you.
Merci beaucoup. Opérateur, dernière question.
Thank you. Merci. La dernière question.
The last question, Myriam Febri, Radio-Canada. You have the floor. Good morning. I'd like to know if for Moderna, it'll be 1 or 2 additional weeks to receive it, and what impact will that have on vaccination in Canada, and which provinces are most affected by those delays? Thank you. Yes. So it's about 1 week to 10 days in terms of delay. We identified pretty early a 3-week cycle that's become a 2-week cycle with Moderna. There was confidence that we could head in that direction. Now, there have been a few delays with the quality assurance process that has a direct impact on our capacity to deliver before the end of a week. There were exceptions like Easter weekend where we had major deliveries over the weekend, but generally speaking, we try to get the vaccines in Europe, bring them here, and then they're sent to different destinations within the country within 2 to 3 days. And there's no change in that regard. The date we're going to pick up our doses has been pushed back about a week for the upcoming deliveries, about a week as well for the end of the month. We'd said the 3rd week of April, but it'll be the last week of April. And if ever there are changes to that timetable, we'll communicate that to the provinces as quickly as possible, as soon as we have the information. Out of caution, we've identified delivery schedules in May that will allow the provinces to plan with more assurance their appointments. And if it is moved up, if it's earlier than expected, then we'll make the necessary adjustments. But now I think we have a very prudent approach with the provinces with a delay of a little bit over a week, and then they can adjust as need be. Inaudible for the interpreter. With a 1-week delay. I didn't understand the beginning of your question. 1-week delay? It's the same number of doses as expected that will arrive? Exactly, the same number of doses that are expected, exactly. 1.2 million by the end of the month, and 2.8 million over the course of the month of May. They'll be distributed according to a timetable we'll share with the provinces today. That will be posted on the web shortly. Thank you very much, Major General.
For today's technical briefing, c'est ce qui met fin au brefage technique pour aujourd'hui. Merci beaucoup et passez une belle journée.
Thank you very much and have a good day.